Tracy, and I'm the club director for Aston Newton Pathfinders in Birmingham. I'm the wife of Mark Sinclair and AC, who's going to follow me after this. And I've got one son who is Marcus Sinclair. By profession, I'm a registered nurse midwife for over 25 years. So I'll be talking to you today about the home nursing honor. Home nursing Pathfinder honor. I just need to remind you that you need to download your worksheet. If you can't download it, you need to print it. And if you can't print it, then you need to write it down, write the questions down, put them in your folders, and ensure that your club director have a look at it and mark you off so that you can proudly receive and wear your honor. The requirements for the Pathfinder honors are you should have the first aid honor. So you can do this honor today, but if you don't have the first aid honor, you need to do that so that you can receive this honor, this home nursing honor. Now, the home nursing honor, it has a number of requirements, 14 requirements, of which I'll run through quickly so that would keep us in tune as we go slide by slide, so you know where you are. So we have to know what foods are included in a liquid diet, a soft diet, a light diet, and a full diet. We need to know the symptoms of fever, know how to take someone's temperature, know how to bring a high temperature down, know what is a normal pulse, normal respiration, and normal body temperature. And I would like you to practice how you can do these with a friend or a relative. We would learn what a communicable disease is, how is it transmitted, what precautions should guard against communicable diseases, and you need to lift safety measures to be observed when you're looking after someone with a communicable disease. Then the other is, oops, what have I done? I need the next one. Okay, so what symptoms tell you that someone is physically ill? Know how to take care of a newborn baby and an old person or an aged person in your home. You need to know when and how to wash your hands when caring for a sick person. Know how to make a bedridden patient comfortable in bed, and show how to feed a helpless person in bed. Then you also need to show how to give liquid medication or medicines to tablets, pills, capsules to children and adults. Also, you need to know how to properly apply eye drops. Then you need to be able to demonstrate the fermentation, demonstrate how the method of giving fermentations and food baths, explain the value of their use, and tell the conditions under which these treatments should be given. You have to demonstrate the application of a heat compress and the use of heat and cold for treatment of inflammation and bruises. And then the last one, it says, explain how the NEWSTART method, remedies, how they help in the prevention of diseases. Okay, so now the NEWSTART honor, the home nursing honor. What do we think this honor is all about, or what is it going to help us to do? You can write in the chat, but I'm going to give you the answers as well.
Yes. What is home nursing, Honor? You want to give us, want to hear
all
some
about? Are we having anything there, Pastor?
Saving lives. We
Yes.
have an answer. Caring for sick people at home.
Good. Good. I can't see the chat.
Yeah, we've just got those two. It's about caring for the sick people.
Okay, yes. So that's the main aim of what the home nursing honor is all about. Looking after sick people at home. I'm sure many of us has look after someone at home, but this session this afternoon will help you to better understand how you should be able to look after someone that's ill at home. And I want us to have the biblical application of being a good Samaritan. So good Samaritans, they help even without being told. So if you're gonna help somebody when they're ill at home, you can be deemed a good Samaritan. Jesus taught us in caring for those who are ill, we care for him. Okay? So when we care for the sick or those fighting against illnesses, we continue Jesus' saving work of healing. And the Bible says we are to heal the sick, raise the dead, cleanse those who have leprosy, drive out the demons. We basically should be good Samaritans. All right, so to begin our session this afternoon, I want us to look at the first requirement, which is asking us for foods that we need to know what are the foods included in liquid, soft, light, and full diets. So if you can put in the chat for me, what is a liquid diet and some of the foods that you can find in the liquid diet.
Okay. Soups. Got soups.
Good.
So I suppose the question will be, do you find what is a liquid diet?
And then list the foods that are.
So we've got soups, like Pastor says, water, stews, juice, smoothie.
Good. Okay. Foods, for a food to be classified as liquid, it would have to be, we would have to be able to strain it when it's heated. Okay? So puddings would not be classified as a diet, but a milkshake would be able to classify as a diet. We said cream soup. What else did we say?
Juice, healthy juice, milkshake.
Okay. And jellos and that jelly, we can also define as a liquid diet. Now, liquid diets, we ask for those diets to be given to people who have struggled sometime with their digestive system, or if somebody is going for a surgery, we ask that they have very light diet prior to their operation, but on the day they really should not be having anything. So those are our liquid diets. Soft diet. What's a soft diet? And what are some foods that we can call soft diet foods?
So we got mashed potatoes, pumpkin. Pumpkin.
Okay.
Somebody say it's sadza.
All right. Soft diet.
Yogurt.
Egg noodles. Mashed veggies.
Good. Pumpkin. Okay. So soft diets can include many foods if they are mashed or if they are pureed. And when I say pureed, I mean they put in the blender or into blender, and it's been mashed really soft or screwed up really soft, so that somebody who has a swallowing problem would be able to take that down them. Cover or place with a sauce of gravy and place in stews, curries, or chilies. And as you have listed, I've got loads as well. So for breakfast, you can have like corn cereals, corn flakes, all of those you can put them, but you need to add the milk so that it becomes really soggy, really soft before we give it to someone who needs a soft diet. Somebody mentioned mashed potatoes, sweet potatoes, mashed.
Porridge.
Porridge, okay. Yeah, rice and gravy, but those need to be cooked very soft. What else do I have? I think I've called them all off. Yep.
I can see here risotto and a few other things.
Yes, I think all baked potatoes with a sour cream or cream cheese, but the potatoes should not have any skin on it. Your lasagna, really cooked, really soft. Muffins, waffles, good.
Okay.
So does anybody have any or know of any person who had to have a soft diet? Or did anyone have to, within their family as a Pathfinder, feed a member of family or someone with a soft diet? We can give soft diet to babies, isn't it?
Yes, somebody says my mom, somebody said, so yes, we do have, but just to let you know, your time is running fast, so.
All right.
Okay.
Okay,
There you
yes.
go.
Foods we include in light diet. So the light diets consist of food which are not too difficult for our bodies to digest. So we've got plant-based alternatives like almond-based, smooth nut butter, tender meats such as fish, but it should not be spicy stuff. What can we say of a full diet? A full diet is a diet that has everything that you don't have to make any exceptionals to have. So it's a general diet, and it also includes us having a drink along with the diet. So you can have all your rice, your meat, whatever you have. Now we move on to the next question, which is we need to list the symptoms of a fever. Can anybody tell me what are some symptoms you would find for a fever?
Yes, I got high temperature here.
Good. So yeah, we can say a fever is an increase in your body temperature, and we call for a cause of concern when it's higher than 39 degrees Fahrenheit or 100 Celsius or 103 degrees Fahrenheit. It says people with fever may feel hot, the temperatures get high and they feel shivery and cold, sweat profusely, and sometimes they have muscle aches and headaches. Okay, the question would have been asked, what would you use to take a temperature? And you would say a thermometer. So you can use a thermometer in the armpit, you can use a thermometer in the mouth. We can use, and then I have some examples of what readings we would have if we take the temperature of a 0 to 4 weeks old baby under the arm. We should use an auxiliary thermometer, and we should use for a 5-year adult, you should use an oral temperature maybe used, but we can also take your temperature in different other parts of your body. Can anyone tell me of what other parts of your body you can take your body temperature?
Okay, we're waiting here. Just keep going. If there is any, your forehead, your
Okay.
mouth. your armpit,
So
your
we
forehead.
also need, as
In
home
the ear.
nursers, if we're gonna do the home nursing, we need to know how to treat a fever. So if somebody has got a fever, we need to be able to take their temperature, determine if it is a fever, and then when we would have determined it, we need to encourage them to do a lot of drinking of fluids. We can wrap them in a warm blanket, and we can cool them in a sponge bath, cool them down. So we can give medications as well. So we need basically to ensure that the temperature comes right back down in such a way that the person is comfortable and they do not get into a state of shock. Okay, if we're gonna give any medication, most of the time we give paracetamols, but we advise that we should not at any time give any tablets to any aspirin to children. All right, so that's it for temperature. Pulse rate. We say that the normal pulse rate should be 60 to 100 beats per minute. And we can take our pulse via we can do the radial pulse, or we can do the carotid pulse, which is by your neck. Okay, and the beats should be 60 to 100 as normal for an individual, but it can go up if you're doing exercises or if you're doing something physical. It would cause your temperature to go up, so you would not have a proper reading if you do it straight after something of that nature. Respiration, you need to have at least 12 to 20 beats per minute for the normal respiratory rate. And then for body temperature, I said that prior, 97 degrees Celsius. So for your homework, you need to master the art, because it's not normally easy to find your pulse rate. So I need you to find your pulse rate, or find the pulse rate of somebody, a friend or a classmate, and ask and give the reading of what reading you would have received for that person. Okay, I'm mindful of the time. Communicable diseases, how do they transmit? What are they and how do they transmit? So do we know what a communicable disease? When we say communicable, what do we mean? We mean that it's a disease that's infectious, and it's something that's been spread, that can be spread by person to person. So presently we've got the disease of cholera, of coronavirus. 2019 it was depicted, and everything surrounds corona at the moment. So I need you to tell me some of the signs and symptoms that you would find for a communicable disease.
Okay, yep, just keep going. I'll be mentioning there is coughing.
Good. Yes, so when we have those symptoms, we need to make sure that we're getting in touch with our GP and ensuring that we're fine, because that's what the WHO, World Health Organization, is advocating that we do. Precautions that we need to take when we, if we come up or if we have to treat somebody with these diseases, we have hand washing, we have avoid sharing personal items, ensure that the persons have a nutritious diet and they're keeping up to date with that. Avoid close contact with anyone who's got a cough or anything of that nature. Okay, moving forward, I need you to be able to say what symptoms there are that would tell that somebody is physically ill. So what is physical illness? It means that it's a deviation from the normal functioning of someone's body. So somebody who has got pain, extreme pain, high fever, lightheadedness, chills, tiredness, those are all signs that the person might be ill. And if anybody is ill, we need to ensure that they see the doctor. Okay? How do you care for a newborn at home? You can take care of a newborn. You have to ensure that the newborn is fed, that they have a comfortable environment so that they can sleep. Diapers are changed and changed regularly. You need to ensure that you hold the baby correctly so that there is no problem with their neck or their head or their back. So you just need to ensure that you hold them uprightly. And when they're outdoors, you need to ensure that they're properly dressed. And if you're transporting them, you need to ensure that they're seating in the correct chair, traveling chair. Okay, how do we care for an aged person, somebody who is old? How do you take care of someone like that at home? You need to ensure that that person is always safe and well. You need to ensure that they have adequate nutrition, that they're drinking well. You need to ensure that they you meet their comforting needs. Some would like to watch a television and that sort of thing. So you just need to make sure that you have a remote control, that if they need to access the TV, that it's easy accessible for them. If they're gonna need to exercise, they need to consult with the GP so that they're not doing anything that would cause them to become ill. You can provide board games, make sure that they're fed well, and that generally they're comfortable. When and how to wash your hands when caring for a sick person. You need to know that, because if somebody is sick, you can pass the disease from them to yourself and to other people. So you need to at all time ensure again that you're washing your hands properly. And we need to make sure that if we're going to care for the person, we need to not be wearing any stuff like jewelry and those sort of things, because if it gets under or in the thing, it's going to cause a mode of transportation of the diseases. Really rushed, bedridden patients. How do you care for somebody who is in bed? You ensure that they're always comfortable in the bed, and some ways of making them comfortable is ensuring that they're lying in a position that's comfortable and safe for them. So for you to do that, because they're bedridden, you would need to ensure that that you have what is called a draw sheet, or a sheet that is able to pull them up or down the bed, so you can be able to change them properly. You need to making sure that they have pillows between their knees, because if the knees are close together and they're unable to move them, they can end up with what we call pressure sores. So you need to ensure that you can have that sort of thing, and they're turned and changed regularly so that there's no pressure sore development or there's no discomfort. What else? Ensure that they're always clean and tidy. And then one of the main things is ensure that you respect the dignity of anyone that you're caring for. So at all times you should draw the curtains. You should also ensure that they're covered when you're changing their clothing and that sort of thing. Helping someone who is helping to feed someone. Sorry?
Someone just put a comment here to say, make sure they don't go to bed unclean. So bathe.
Unclean.
Yes.
Okay, thank you for that. Yeah. So if you're feeding someone who is helpless in bed, we're gonna go back to the diets that we've listed earlier. We have to ensure that they're having the correct diet. Okay, so the correct type of food. So if they've got a swallowing problem, you need to ensure that they're having either a very soft or a liquid diet, so that you ensure that they don't choke when you're giving them the food. If you're giving them drinks, they should have like thickeners that's prescribed by the doctor, so it's of a consistency that it's easy for the person to follow. You need to ensure that you're meeting their meal times. At least possibly every 4 hours you should feed them, so that to maintain their proper digestion. You should also allow the patients to allow them to you should make sure that you're not rushing them when you're feeding them. Sorry, should not be rushing. So give them enough time to swallow it, enough time to eat their foods. Then after food, I'm gonna go to medication. how do we give liquid medication and pills and those things to the elderly and to children. So normally children, you don't give them any sort of capsules, you either give them liquid medication, and if necessary, crushed medication that's prescribed by the GP, because not all medications you can crush, because you can damage the consistency and the value of the medication. You must read your labels to ensure that you're giving the correct doses. So the kids, and then for those who can drink and who can drink or swallow, you make sure that you use a dosage cup to give them to give them the medication. You need to always make sure that they have taken it, whether it's an adult or a child. You make sure that once you're responsible to giving, you make sure that they've taken it and they haven't put it to the side or anything like that, because they can react to not having their medication. How do we instill eye drops or apply eye drops? Some people say apply, I say instill. So you need to make sure that you inform the person that you will be giving them their eye drop. You need to ensure that it's correct eye drop and you're giving it at the correct time and the correct amount. You ask the person to tilt the head backwards and gently pull the lid of the eye down. But firstly, I should have said you must ensure that you would have washed your hands before you started doing that. And then you ensure that the drop is given into the tear duct, and then ask the person to close their eyes tightly, and the eye drop will be instilled. We've got fomentation. Does anybody know what
Just before you
fomentation
proceed,
is?
can I just respond? I know that we've had to pick up the pace a little bit. I can see some comments. Of course, the struggle we have is we've got limited amount of time for which to cover. So may I request, Pathfinders, because this is going to be recorded and we're going to have it online, if you can, whatever is left, if we have time at the end, we can ask questions, or else we will request you to go back into the recorded version to try and find the information out there. So thank you so much for your understanding. That's the reason why we had to pick up the pace. Thank you once again. Back to you, Karma.
Yes, so fomentation. So these are liquids or warm liquids or ointments that we apply to the body skin. Some people would call them stuff, say, poultice, or just basically fomentation is a word that's being used. So you apply this to the body and make sure that it's not too hot or not too cold for the individuals that's going, and you normally do it for up to 1 hour. The same is for foot baths. Foot baths, you would put somebody's, you put Epsom salt or some sort of medication into water at a temperature that's acceptable for the individual, that's not too hot, that will cause them to have any burn or anything. You put them in and you allow the leg to soak or the foot to soak, and then you towel dry it after. Conditions which you can use fomentation for, it's for people who would have had an abscess. You can apply that to an abscess. You can apply it for people who need increased circulations, people with aching joints, and it also aids in the relieving of congestion. Relief. You can also give foot baths for the relief of foot pain, arthritis, and general muscular pains. If someone is having those, you can encourage a foot bath. Application of heat compress. You can apply them for strains or muscles or ligaments, strains to the muscles or ligaments, and you can apply them for you should use ice or cold packs immediately and for the next 36 hours. So if somebody comes down with a muscle or a ligament strain, that's what you need to do. So somebody went and played football and they end up with that. So they come home. You're the nurse. You just need to do that to help them out. Do not use heat or heating pad until the swelling or the bruising has stopped. Cold is used first to reduce swelling and inflammation. Okay, cold ice pack for 20 minutes, remove for 20 minutes, and then you repeat that over a 4 to 6 hours period. And that should be able to help someone to relieve their pain. That's what this slide is talking about, how many, how heat compress can be used for the treatment of inflammation and bruises. It helps to dilate the blood vessels surrounding the painful area, increasing blood flow, and provide additional oxygen and nutrients to help the damaged tissues to heal. It also increases the flexibility of the soft tissues surrounding the area. What time? So we need to find out, or we need to understand how natural remedies and the natural remedies we'll talk about, they spell out the word NEWSTART. So I'm going to ask if we can list what are these natural remedies that I'm on about.
Okay, NEWSTART. Does anybody know what is NEWSTART standing for?
Okay, so
Nutrition.
what does N start for?
Somebody's put in nutrition.
Okay, have we got a consensus on nutrition?
Yes.
Nutrition, we've got nutrition, yeah.
Good, yes, so nutrition. What's E for?
Exercise, I'm seeing exercise.
Good, good. W?
Water.
Good, water. And then the big S?
Sunshine.
Sunshine.
Good, good. We all know our natural remedies. T?
Temperance.
Good, good, good. A?
Air. Seeing air here.
Okay, what else? What do we see for R?
R, guys. Rest. Yes, rest has popped up.
Good,
Rest.
good. And the last T?
Trust in God.
Good, all right. So I've got a pack of brilliant, awesome, fabulous Pathfinders. So nutrition, when we talk about nutrition, we talk about eating, and we talk about eating, not just eating, but eating the right foods for our body. Okay, so we just don't put anything into our body. We put the correct food. We ensure that we're having all the nutrients at the meal which we would be having. So you look on our plate, we must have all our carbohydrates, not too much fats, and the rest of the nutrients, yeah? Exercise. Not everybody likes to exercise, but exercise is very important. So it's important that we ensure that we have exercise as part of our daily plan. So if you can't get to the gym, make sure that you're getting some walk, or you're doing some star jumps, or you're doing something that helps you to ensure that your body is functional at the right level. Exercise improves the health of our body, mind, and the spirit. So we must ensure that we have the exercise, and if you cannot do it outdoor, then try and get something done inside. Water. Our body is comprised of more than 70% of water, and we're encouraged to ensure that we have taking no less than a liter of water daily. So if you can have more, make sure that you always have water with you so that you keep yourself hydrated and you're able to flush the bad stuff out of your body by ensuring you drink adequately. Sunshine. England is not the best place for sunshine, but to God be the glory, we've been having some lovely sunshine. And I encourage us, whenever the sun comes out, make sure we go outside and suck it up so that we can ensure that our vitamin D is topped up at every convenience we have. It says the sun is a major source of energy, and sunlight is important for metabolic balance. A big word, but it just means body functioning. Temperance. Um, Too much of one thing is not good. So we need to ensure that in everything that we do, that we're being temperate. We're ensuring that we're having a balance. Air. We should ensure that we receive a regular supply of fresh air. And one of the ways in which we should ensure is that we should try as much as possible to go outside. And if we're not going outside, just ensure that you open your windows. When you sleep at night, ensure that there's one of the windows are open into your room so that there is some form of fresh air coming in so that you can breathe into it. Sometimes we have it to come in contact with people who are smoking, and sometimes it's not the most comfortable environment to be in, but we try as much as possible and as quickly as possible to get away from such surroundings. All right, rest. Rest is very important. I look forward to Friday afternoon. I just switch off and get ready to enjoy my Sabbath rest. God gives us rest. He admonishes us to ensure that we we rest a while because it helps us to renew ourselves, help us to function even better. It helps us to be better people. Sometimes you find that the people who work 7 days a week, they're very grumpy and they can't even smile because all they're thinking about is work, work, work. But we need to rest our body so that we can be renewed, and that can be both physically, spiritually, mentally, generally, our entire body. We need to ensure that we get adequate rest. Um, Trust in God is the last one. We as Christians, we have been encouraged, we've been admonished to trust God where we cannot trace Him. And once we trust God, we know that we're not making a bad choice. We're making the best choice because only He knows what's best for us. So whatever our concerns, whatever our challenges, our situation, any situation that come our way, we need to take it to Jesus and trust Him that He will do what is best for us. That was my last slide. Is there any?
Okay. Yeah, thank you.